Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're going to be focusing on concepts with OBGYN for routine care and pregnancies, childbirth, and delivery. We're looking at codes Z30 through Z39 and O00 through O9A, and we'll be utilizing our Let's Code It textbook for chapters 17.4 and 17.7. Now, before I get started, just to let you know, I will be referencing pages out of my coding book and some of the tools and guidelines we have, which is the AAPC ICD-10-CM 2019 Expert Edition. If you have a different version than this, but you're using the 2019 code book for the ICD-10-CM, all of your codes should be the same. However, you will have differences in page numbers and, of course, at times, some of the additional reference tools that are found in different code books and the different editions. So, all right, let's get started. Our key points, we'll be looking at routine care, a little bit of talk about genital urinary, but I'm going to make another video later on when we go into specifics about the male and female systems, including genital urinary, where we'll be coming back to chapter 17 to look at those details. So we'll just be looking at a little bit of key points and identifying the differences today, and then most of our topics we'll be talking about the different levels of pregnancy, labor, and delivery. So first things first, what you want to do whenever you're looking at the female system is you want to say, what is the purpose of our visit today? So the first things we have, and I've put up on the board for you, are your routine care. And this should look familiar if you've already learned about factors that influence health status. You'll notice that we start off this chapter looking at some of the different information specific to OBGYN in the Z code categories. So the first thing to consider is your GYN physical versus a regular physical. You want to keep in mind that the purpose is your most important factor. So if the patient is seen by an OBGYN specialist and they're doing a GYN physical, then that is the purpose. But this can also be called a well woman exam or a GYN visit, GYN check, just anything pertaining to female anatomy. And so we already have GYN up there. I won't repeat it here. Okay, but it's also known as a well woman exam or a GYN physical check and so on. Now, once you've identified that the purpose of your visit is to do a routine physical with a focus on the female anatomy, then you want to look at category Z01.4 and identify exactly where you're at. So you'll notice that there's a slight difference from the Z00, which is encounters for general exam without complaint, suspected, or reported diagnosis. And these are specific, Z00 is specific to adult medical exams versus Z01.4. Z01 starts with the category code as encounters for other special exams. And so your difference is general versus special exam. And this is a special exam when we're focusing on the female anatomy. When we get to point 4, this is identifying the type of special exam as gynecological. And it does exclude any pregnancy exams or tests, which we'll talk about in just a moment. And there's also a separate reference for exclusions on contraceptive medicine. And so if your encounter is to strictly talk about contraceptive medicine, or if you're looking at orders for a prescription, you'll want to make sure you add that code. So a patient can come in, and most often they will, for the GYN physical where they want to get a pap done and they want to get some sort of pill or injectables or other contraceptive medicine, you'll have the Z01 code and the code for the pap and the code for the medicine if it's prescribed and discussed. So keep those in mind. There's different focuses, but if they just come in for a pap or just a contraceptive medicine, then you would list the code for that and not the GYN physical. So that's really important when you talk about when a patient comes in, and let's just talk about insurance for a minute. Most of the time, the insurance company is going to pay one physical, sometimes 2 per year, and the patient may have been on their period. So the provider is going to do a complete GYN visit minus the PAP, and then they're going to return for their PAP. And at that time, they do not get another physical because it's already been covered. So it's important to link the purpose to what they're being seen for. And the Z12.72 is our PAP, by the way. Or if maybe they come in and they've already seen the provider a couple months ago. Let's say you have a 16, 17-year-old female. And she came in and the doctor wanted to ask, are you having sexual relations? She said no. And she didn't want to talk about it at that time. Maybe a mom was present or some other complication. Maybe she just wasn't ready. Hopefully that's more the case. So she gets her regular physical. They do some GYN focus. And later on, she makes an appointment within that year because she says, you know, I got a boyfriend and I would like to get on the pill. I've already had my physical for the year. Can I just talk to you about contraceptive maintenance? And so at that point, contraceptives are going to be a counseling purpose. And so you'll find those under Z30.4. And you can flip, I'm on page 1260 in the ICD-10-CM book, looking under the excludes 2, and it gives me that reference. So I can go over to Z30.4 and say, oh, you know, the notes here say that she came in specifically for contraceptive maintenance, and she was seen for counseling on that. They decided to do, put her on the pill. And so Z30 falls under encounters for contraceptive management. That's our category code. And then .4 is surveillance of contraceptives. So you want to take a step back and say, wait a second, is that actually the correct code? And so we have Z30 dot, and I'm just going to put a dash because it changes depending on the type of contraceptive. So even though Z01.4 told me routine exam for contraceptive maintenance, Z30.4, always look at your category code. Always read up and down. Make sure that your category code identifies all of the purposes. So in the example I gave you, the patient's coming in, she decided to get on the pill. She was told she could talk about it at her physical earlier in the year. She didn't want to talk about it then, and so this is her initial appointment to get on the pill. And so instead of .4, you'd actually be looking at encounters for general counseling and advice on Z30.0. And if you look here, Z30.01, encounter for initial prescription of a contraceptive, versus Z30.4 is encounter for surveillance of contraceptives. So that very first visit, you're going to be your initial prescription, the first time she gets on this prescription for the contraceptive, and they even break it down as to what types of contraceptive it is. Versus she's already been taking it, we went ahead and refilled it, and Z30.4 was the purpose for that. So you want to pay attention to your different subcategories under the main category. So remember, your main category is also always the first 3 digits of the code, and even though you have a reference to what code you might be looking at, it's only a suggestion. So you'll want to make sure to identify the different category that your code falls under and then break it down. Same thing here on our PAP. In our book, we're referenced to the cervical pack for Z12.72, which is listed as encounters for screenings of malignant neoplasms of the vagina or vaginal pap smear. Most of the time, though, if I go to Z12 as the category code, and I want to point this out here as well while we're at it, look at the encounter code, the category first, Z12 by itself, screenings for malignant neoplasms, which is exactly what a pap smear is for. When we're going in and we're doing the pap smear itself, they're looking for cancer within the cervix or the vagina. And so when we go to Z12.72, we want to stop at Z12.7, and we see encounters for screenings of malignant neoplasms of other genital urinary organs. And so that's always a key for me. Anytime I see the word other, I want to stop there and say, whoa, whoa, whoa. Before I say other, is there somewhere else within these codes that might apply? So if it was in fact the vagina, which is Z12.72, then that would be the correct code to identify the type of pap smear I did. However, remember most of the time, for any of you that are female and have had a pap smear, or that are male and have talked about it with your female relationships, either family members, friends, or otherwise, most of the time they go in and they do the pap smear from the cervix. And so if you look up, if you read up and down under category Z12, you'll actually see that if they are looking at the cervix under Z12.4, you will see encounter for screening of malignant neoplasm of the cervix. Excludes when screening is part of a general gynecological exam. Excludes if it's for screening of the human papillomavirus, which references you to Z11.51. And so it's still important to identify, well, which part are we doing here? Okay, so if we're looking at the human papillomavirus, you'll want to go back over to Z11.51 if it's of the cervix. If it's done with the general exam and they're not on their period, so they did their pap, you're just going to list the one code, not the two. If the whole purpose is for the pap, you want to identify where did they get it from. So you'll kind of be all over the board in this, and that's okay. As you learn to code more, pay attention to where is it, where is the service being done, for what purpose, okay? And when you identify these, they will identify the proper code to use. Same thing with contraceptives, okay? So what type is a big one here, and you have to identify that as you're going through. Okay, so that's it for our routine services. The rest of the routine services you see within the GYN visit are your basic screenings that are identified as needed that you might see at the same time you do a regular physical. There's a lot of times where there's confusion as to what the purpose of a visit is, and so you should always reference your HPI. Look at the chief complaint. Why did the patient schedule the appointment? What is the assessment? What did the provider state that they were there for? And was there an overall focus for a specialized physical in the GYN system, at which time they can do a lot of other services that are part of the normal physical as well. Okay, so that's the most of your routine encounters. Now keep in mind, anytime there is a condition found, and we have some examples of endometriosis, uterine fibroids, and pelvic pain, you want to pay attention to what is it related to. So endometriosis and uterine fibroids have their own categories based off of the type of system that it's for. Endometriosis is found in your categories for N80, whereas uterine fibroids will be found under category D25, okay? And pelvic pain is one of those really confusing ones. So pelvic pain we'll talk about here in a minute. You have two different types. You have related in the pregnancy area, which falls under your O categories, or you have it as a symptom that's not related to pregnancy, which falls in your R categories. We'll talk more about symptoms and signs next time when we talk about signs, symptoms, and all the codes that are under the R categories. But right now, just thinking about conditions in the female system, you want to make sure to identify, is it related to pregnancy? And if so, think about OB for obstetrics. You always have a pregnancy code for O. If it's non-problematic, you'll find it under your Z categories for services that are routine or other than an illness or injury. So factors that involve their health. Now I'm going to go ahead and make this into 2 videos. When we come back though, we're going to talk in detail about pregnancy coding, complications, and the multiple codes that you'll need to list when coding for a pregnancy encounter. Make sure to click on part 2 of our OBGYN services for this week's topics on ICD-10-CM coding.